Hi students, myself is G. Nikita, Assistant Professor in the Chemistry Department. And I will deal the Medicinal Chemistry 2 subject for the B Pharmacy third year's first semester. So in this we will discuss the anti-anginal agents. It is belongs to the second unit. So angina means it is belonging to the cardiovascular disease, means it is related to the heart disease. And in this we will discuss the introduction, means what is the angina pectoris and what are the symptoms the person will suffer, and the types of the angina pectoris, and the classification, means what are the drugs which are used in the treatment of the angina pectoris, and what is the use of the vasodilators and calcium channel blockers in the anti-anginal agents, and mechanism of action, means how the drug is worked to reduce the angina in our body. Next, SAR means structural activity relationship, structure, synthesis, adverse drug reaction, means what are the side effects are caused by the drug and uses. So before knowing about the anti-anginal drugs, let's know what is the angina pectoris. So angina pectoris, it is belonging to the symptoms of the ischemic heart disease. So here there will be the imbalance between the demand and supply of the oxygen, means what will happen here means the how much amount of the oxygen is required for the heart, that much amount of the oxygen won't get. So there will be the more demand of the oxygen for the heart. So it will lead to the cause of the angina pectoris, means here what will happen if the heart cannot able to get the sufficient oxygenated blood, means there will be the more pressure in the heart, and it will lead to the raise in the body, heart beat. So if the heartbeat will be raises, means what will happen, that it may cause the angina pectoris, and also the blood pressure increases, and also will lead to the causes of the different heart diseases like heart stroke, coronary artery diseases. So in this it is characterized by the, it will cause a severe pain in the middle chest, and that will be spread to the left body parts like left arm, jaws, teeth, and sometimes also it will spread to the right arm also. And angina is mainly occurs due to the some of the reasons like thickening of the heart muscles, means if the muscle of the heart will become thick, means the heart cannot able to flow the blood easily. So there will be the formation of the clot in the heart. So there will be the blockage of the heart. So the blood cannot easily flow. And by also by the coronary artery disease, hypertension means raising of the blood pressure, and also the person, those who have the habituated of the smoking is also can be seen the angina pectoris. So in the condition of the angina pectoris patient, what will happen means, if you see the normal functioning of the heart, so the blood is easily flowing. But if we see here, here the cholesterol is formed. So if the cholesterol is formed, so if we see can observe here, the blood cannot easily flow, means there is a blockage is formed. See, the blood is cannot able to flow easily due to the formation of the cholesterol here, and it leads to the blood clot here. Here the blood clot is formed, we can able to see that. So if there is any of the clot or the narrowing of the blood vessels, means the heart cannot able to flow. See here, the if the arteries are getting constricted, so if the arteries get constricted, means it cannot able to flow the blood easily, and here it will lead to the blood clot. So for this reason here, to avoid the blood clot, and also the by also means avoid the blood clot, we have to do the surgery or we have to use the anti-anginal drugs. And means if we do the surgery means we have to place the stents in order to avoid the clot of the blood in the heart. So if the person is and if the person is suffering from the angina pectoris means he will feel the pain in the chest and also in the neck part, and also that he can't able to do his work lonely means that he will feel the pain in the chest. So we can observe here the blood is clotted due to the formation of the cholesterol. So if we use the drugs in order to remove the clots in the body, means see if we see that here are the blue colored sparks are there, no, this we can assume it as the drugs. So if the drugs will be passed along with the blood means the blood can easily flow by clearing its clots, so then the heart can be easily function and the blood flow will be the normal. And also not only by using the anti-anginal drugs and also by using the stent. See here we can see the stent is placed in the heart walls. So if we place the stent in the heart walls, what will happen means the walls or the heart will become thick and there will be the easy flow of the blood. So we can able to clear the clots which are present in our heart by two ways, means by using the anti-anginal drugs and also by using the surgery, means by placing the stents in the heart. So by these two ways that we can able to remove the clot from our blood from our heart, and the heart can easily flow the blood, and it can also easily supply the oxygenated blood to the various parts of the body. So symptoms means the angina pectoris, the person those who are suffering from the angina pectoris, that in the patient that we can see that the symptoms like more sweating, the person will feel the weakness, the discolorization of the skin, shortness of the breath means the person cannot able to breathe properly, nausea, vomiting, digestion problems, and that pain in the left arm and chest pain. Sometimes the pain may be spread to the right arm also. So these are the symptoms the person when he is suffering with the angina pectoris will occur. Next, what are the types of the angina pectoris? So first one is the stable, and it is also known as typical or the common angina. So common angina name it came because this type of angina can be seen in commonly in all people, like if the person did the more exercise, excessive exercise means that more than his body bearable. So if he did more and excessive exercise means he will get the angina. And emotional stress, so if he did the excessive or more exercise or emotional stress, then the person can face the stable or common angina. And next, unstable or uncommon angina means this angina will come all of sudden and the chest pain will be severe in that person, and later on it will go on becoming serious. The person should be immediately hospitalized, should be admitted in the hospital and should immediately give the treatment, because in this what will happen means here the blood will be clot in the heart and it cannot able to pump the blood properly, so it will lead to the stroke and it will cause the angina pectoris. Next, third one is variant angina, and it is also called as pterygimental angina. Means this type of angina is commonly seen in the women at night time. So this type of angina will occur by coronary vasospasm, means constriction of the heart. So if the heart is more constricted means it will get more pressure in the heart. So it will leads to the cause of the angina. Next, last one is microvascular agent, means this is the newly discovered angina. In this, what will happen means the person will feel the chest pain, but there is, if we see the person's heart or ECG, means there is no only block in the heart. So next, classification means the drugs which are used in the treatment of the angina is known as anti-anginal agents. So here, first one is vasodilators. In this first one is organic nitrates or nitrites. It is also known as short-acting compound. So in this first drug is amyl nitrite. So if you see the structure here of the amyl nitrite, here 1, 2, 3 and 4 carbon atoms are there. If there is the 4 carbon atoms, means it is the butyl. In the second position, if you see the methyl group is there, so it is named as, in the second position methyl group is there. In here the nitrate group is attached. So this is the structure of the amyl nitrite. See here, 4 carbon atoms are there, and at the second position methyl group is there, and here at the fourth position the nitrate groups are attached. Second drug is nitroglycerin. Here if you see the structure, 3 carbon atoms are there. So 3 means propane. For this propane, 3 oxygen atoms are attached. See here, 1, 2 and 3 carbon atoms are there. And to these carbon atoms, 3 nitro groups are attached. So this is the structure of the nitroglycerin, means here 3 carbon atoms are there, 1, 2 and 3. 3 carbon atoms means propane. To this 3 carbon atoms, the 3 oxygen atoms are there, 1, 2 and 3. So for these oxygen atoms, 3 nitro groups are attached. So next one is long acting compounds. Here first drug is isosorbide dinitrate. So this is the structure of the D-glucose. So for this, here in the third and the seventh position, hydrogen atoms are attached. In second and sixth position, oxynitro groups are attached. See here, in sixth position and the second position, oxynitro groups are attached. In the fourth and the eighth position, oxygen groups are attached. So this is the structure of the D-gluticol. So for the D-gluticol, in third position and the seventh position, the hydrogen groups are attached. In second position and the sixth position, oxynitro groups are attached. And in fourth and eighth position, oxygen groups are attached. So this is the structure of the diisosorbide dinitrate. And next one is isosorbide mononitrate. And this here, between these two structure, what is the difference means, if you see here the structure of the isosorbide dinitrate, in the second position nitro groups are there, but for the isosorbide mononitrate, in the second position the nitro groups are not there, only presence of one nitro group is there for the isosorbide mononitrate. Only there is, this is only the difference between the isosorbide dinitrate and isosorbide mononitrate. See, if you see her structure, this is the structure of the D-gluticol. In third position and the seventh position, hydrogen atoms are there, and in sixth position the nitro group is attached. In fourth and eighth position, oxygen groups are attached. Next drug is penta-erythral tetranitrate. So if you see here structure, 1, 2, 3. 3 carbon atoms means propane. In the second position, if you see upside and the downside, in the second position of the carbon atom, the methoxy and nitrate groups are attached. See here, in the, this is the methoxy and this is the nitrate. Here also methoxy and nitrate groups are attached here. And in third and the first position, nitroxy groups are attached. Means 1, 2, 3. 3 carbon atoms means propane. In the second carbon atom of the propane, the upside and downside, two sides, the methoxynitrate groups are attached. And in third position and the first position, the nitro groups are attached. So this is the structure of the pentaerythral tetranitrate. Next, peripheral coronary vasodilators. In this first one is potassium channel activators. So first drug is nicorandil. Drug name is nicorandil. And this here we see, if we see the structure here. So this is a 6-member ring. 1, 2, 3, 4, 5. 6-member ring. And the nitrogen is present at the first position. And at the third position, the acetyl group, amide, and ethyl group and nitro groups are attached. See here, 6-membered ring, and at the first position nitrogen, and the third position the acetyl amide group is there. NH means amide group. If you see here, 2 carbon atoms are there, means ethyl group, and this is the nitro group is attached. Next drug is minoxidil. If you see here, if you see the structure here, this is the structure of the pyrimidine. So here for the benzene ring, 2 nitrogen atoms are attached. This name is pyrimidine, and to the pyrimidine in the second position and the fourth position amide groups are attached. See here, second and the fourth position amide groups are there. In the third position oxygen group is attached. In the sixth position the piperidine is attached. See here, piperidine means presence of, for the benzene 6-member ring, the nitrogen group is there. So this is the pyrimidine structure, and it means it contains the 2 nitrogen atoms for the 6-membered ring. For this pyrimidine, in the second and the fourth position amine groups are there. In the third position oxygen group is there, and in the sixth position piperidine structure is attached. So next, diazoxide structure. If you see here, diazoxide, this is the structure of the benzothiazine. So benzothiazine means these two are benzene structure. Thia means sulfur group, aza means nitrogen, so commonly known as benzothiazine. So for this benzothiazine, in first position 2 oxygen atoms are attached. In second position amide group is attached. In third position methyl, and in 7th position chlorine group is attached. I will explain it again. So this is the structure of the benzodiazine. So here in the first position of the benzodiazine, the oxygen atom is there. In the second position amide group is there. Third position methyl, and 7th position is chlorine atom is there. So this is the structure of the diazoxide. Next, other peripheral vasodilators. In this first drug is dipyridamole. So if you see here structure for the dipyridamole, so this here 2 benzene rings are there. In first, third, fifth and 7th position the nitrogen atoms are attached. And here in the second position and the 6th position 2 nitrogen amide groups, and these amide groups are attached to the ethanol groups. So there are 4 ethanol, 1, 2, 3 and 4 ethanol groups are there. And in the 4th and the 8th position is attached to the piperidine structure. See here, 4th and 8th position the piperidine structure is there. So I will explain it again. Here 2 benzene rings are there. So in first, third, fifth and seventh position, the nitrogen groups are attached, and in second and the sixth position, amide groups are there, and this amide groups are attached to the ethanol groups. So 1, 2, 3, 4 ethanol groups are there, and fourth and eighth positions are attached to the piperidine structure. See here, two piperidine structures are there. Next one is papaverine structure. So if you see the structure of the papaverine, so this is the structure of the isoquinoline. So if you see here structure of the isoquinoline, that this is one of the benzene and this is the structure of the quinoline. So benzene and the quinoline structures are attached. So here in the first position of the isoquinoline, here the 4,5 dimethoxy is attached. See here in the fourth position and the fifth position, OCH3 means methoxy. So in which positions we have fourth and fifth position? So it is dimethoxy and this is the phenyl. So 3,4 dimethoxyphenyl, which is attached at the first position of the isoquinoline structure. So in the structure of the isoquinoline at the sixth position and the seventh position also, dimethoxy groups are attached. Next, calcium channel antagonist means it will block the release of the calcium channels. First one is phenyl alkyl amine derivatives. First drug is varapamil. If we see here, pentanitrile is there. See here, 1, 2, 3, 4, 5. 5 carbon atoms means pentane structure. Pentane. So for these 5 carbon atoms, in the second position, if you see here upside, there are 3 carbon atoms are there. See 1, 2 and 3 means propane. So in the second position, propane is attached. In another second position, the 3,4 dimethoxyphenyl is attached. See here, in third position and the fourth position, the methoxy group is there. So it is named as 3,4 dimethoxyphenyl is attached to the second position. And in first position, nitrile is present. Nitrogen atom is present with triple bond. Here in fifth position, the methyl amide is attached. So that to the methyl amide, here ethyl group is attached. See here 1, 2. 2 carbon atoms means ethyl, and to this ethyl atom, the 3,4 dimethoxyphenyl is attached. See here 3 and 4th position, the methoxy group is attached. So it is dimethoxyphenyl which is attached to the ethyl group, and this ethyl group is attached to the methyl amine. See here, this is the methyl and N means amine. So methyl amine, this is attached to the fifth position of the pentane structure. And here in the second position at 1 end, the propyl group is attached. 1, 2, 3. 3 carbon atoms means propyl, and here 3,4 dimethoxyphenyl is attached. In the first position, nitrogen group is attached with triple bond. So this is the structure of the varapamil. Next, bepridyl. If you see the structure of the bepridyl here, 2 benzene rings are there, 1 and 2. So these benzene rings are attached to the nitrogen atom, and this is attached to the propane. See 1, 2, 3. 3 carbon atoms means it is named as a propane, and it is for the propane in the second position, the 5-membered ring with nitrogen is attached. And here in the third position, the oxygen group is attached. So this oxygen group is again attached to the 2-methyl propane. I will explain it again. Here, if you see the structure here, 2 benzene rings are present, and this is directly attached to the nitrogen atom, and this is attached to the 3 carbon, if presence of the 3 carbon atoms means propyl. So it is attached to the propane. And this in the second position there is a 5-membered ring. See, 1, 2, 3, 4, 5-membered ring with nitrogen at the first position, and here the oxygen atom is attached. For that oxygen atom, if you see here second position, the methyl is there, so 2-methyl propane. So this is the structure of the bepridyl. Next, benzothiazepine. So here if you see the structure of the benzothiazepine, see here, this is the benzene and this is the thiazepine. So thiazepine means, thia means sulfur, aza means nitrogen. So presence of the sulfur and the nitrogen for the 6-membered rings is known as benzothiazepine. For this structure, in the second position, 4-methoxyphenyl is attached. See here in the fourth position, the methoxy is attached. So it is named as 4-methoxyphenyl. And in the third position, acetyl group is attached. And in the third position, acetyl group is attached. In the fourth position, oxygen group. And in the fifth position, here 1, 2. 2 methyls means dimethyl, and this is amine which is attached to the ethyl. 1, 2. 2 carbon atoms means ethyl. So it is attached, named as the dimethyl amine ethyl. Dimethyl amine diethyl. I will explain its structure again. So this is the structure of the benzothiazine, means benzene structures, and thia means sulfur, aza means nitrogen. So for this benzothiazepine, in the second position, 4-methoxyphenyl is attached. In the third position, acetyl group is attached. In fourth position, oxygen group is there, and in the fifth position, dimethyl amine ethyl group is there. Next, dihydropyridine derivatives. So this is the structure of the dihydropyridine. If you see here, R1, R2, R3 and X. So if you replace the different atoms in this 4 positions like R1, R2, R3 and X position, we will get the different drugs. So if you see here in the first generation, first one is nifedipine. If you replace in the R1 position methyl, R2 position methyl and R3 position methyl, and in X, in the second position, if we replace the nitro group, means we will get the structure of the nifedipine. Next, second generation is amlodipine. In the first position means R1 position, if you replace the diethoxy and amine group. See here, ethyl group, and here one of the ethyl group, and this is the oxygen, and this is the amide group. So this compound is replaced in the for R1 position, and in the R2 position is ethyl group, R3 position is methyl group. In X position, that too in the second position, if we replace the chlorine atom, means we will get the amlodipine structure. Next, felodipine means in R1 position methyl group, in R2 position ethyl group, in R3 position again methyl group, in X position that in the benzene ring in second and third position the chlorine atom should be placed. So then we will get the felodipine. Next, nicardipine. If you replace in R1 position methyl group, and in R2 position the benzene ring, in the para position the ethyl ring and nitrogen, methyl and 2 ethyl groups are attached. See here, this is the benzene, and at the para position ethyl group, nitrogen, methyl and diethyl groups are attached. This structure should be in the second position, that is R2. In R3 methyl groups, and in X is in the second position of the benzene ring, the nitro group should be attached. Then we will get the nicardipine. Next, nimodipine. Next drug is nimodipine. If you see the structure here, In R1 position, the methyl group is there. In R2 position, diethyl. So see here, two ethyl groups are there. Diethyl oxygen group and one methyl group is there. Diethyl oxygen, one methyl group is there. And in R3 position, methyl group should be attached. In R4 position, at the third position, means in the X, if you see the benzene ring, in the third position, the nitrogen is present, means we can get the structure of the nimodipine. So these are the drugs which comes under the dihydropyridine derivatives. In first generation, nifedipine. Second generation, amlodipine, felodipine, nicardipine and nimodipine. So these are the drugs which comes under the dihydropyridine derivatives. Next, beta blockers are known as beta receptors antagonist. See here, first drug is propranolol. So if you see, this is the structure of the naphthalene, means two benzene rings. Naphthalene at the first position, oxygen atom is attached to it, propyl group is attached. See here, 1, 2, 3 means propane. At the second position of the propane, hydroxy group is attached. And at the third position, the amide group and propane group is attached. 1, 2, 3 means propane. I will explain it again. This is the structure of the naphthalene. And in the first position, the oxygen group is attached. So that to the oxygen group, 3 carbon atoms means propyl. 1, 2, 3 means propyl. In the second position, hydroxy group is there. And in the third position is attached to the amide group. And this amide is attached to the propane. 1, 2, 3, propane. Next structure is nadalol. Nadalol. So if you see the structure here, two 6-membered rings are there. And at the first position and second position, two hydroxy groups are attached. In the fifth position, oxygen is there. And this oxygen is attached to the 1, 2, 3 means 3 carbon atoms means propane. At the second position, or hydroxy is there. And the third position is attached to the amide group and 3 methyl groups. I will explain it again. Two benzene rings are there. So at first position and the second position, the two hydroxy groups are attached. And in the fifth position, then oxygen group is attached, and this oxygen group is attached to the propane. For the propane, in the second position, the hydroxy group is there. In the third position, amide and 3 methyl groups are there. Next structure is atenolol. If you see the structure here, this is the benzene, has 6 members, 1, 2, 3, 4, 5, 6. So in the first position, here the acetyl group is attached. See here, the acetamide group is there. Acetamide in the first position, and in the fourth position, oxygen and propane. 1, 2, 3, propane, 2 hydroxy and 3. In the third position, the methyl, in third position, 1, 2, 3. 3 carbon atoms there means what is there? Propane, amide. So this is the amide. Propane, amide is attached to the third position of the propane. I will explain it again. This is the benzene ring. In the first position, acetamide is there. In the fourth position, oxygen atom. This oxygen atom is attached to the propane 2 hydroxy structure at the first position. And in the third position, the amide group is there, and 3 carbon atoms are there. No, so it is the propyl groups are attached at the third position of the propane. Next, miscellaneous drugs. First drug is aspirin. If you see the structure here, so if you see here structure of the aspirin, this is the benzoic acid. So here in the first position, COOH is there, no? So it is named as the benzoic acid. And in second position, the acetyl group is there. acetyl group is there in second position. So it is the structure of the aspirin, that is it is a benzoic acid, and in the second position the acetyl group is attached. Next drug is clopidogrel. See here clopidogrel, and if you see here structure, this is benzothiazine. So if you see this clopidogrel structure, so this is the structure of the thiopyridine. So thio means sulfur, and this is the structure of the pyridine. So this is commonly known as thiopyridine. So that here acetyl and the methyl group is attached, and here two chlorophenyl group is attached. If you see the structure of the chlorophenyl in the second position, see here second position of the phenyl, the chlorine atom is there. So it is known as 2-chlorophenyl is attached. I will explain it again. So this is the structure of the thiopyridine. See here, this is the structure of the thiopyridine. And for that here acetyl group is attached. See here acetyl group, and here one of the methyl group, and here 2-chlorophenyl group is attached. Next, ticlopidine. Next drug is ticlopidine. If you see here the thiopyridine structure, this is the structure of the thiopyridine. To the thiopyridine at the fifth position, here one of the methyl group will present. So to that methyl group, 2-chlorophenyl is attached. See here in second position, the chlorine atom is attached to the phenyl structure. So it is named as 2-chlorophenyl. This is a structure. I will explain it again. So this is the thiopyridine structure. Thiopyridine structure at the fifth position. Here the one of the methyl group is attached, and here and 2-chlorophenyl group is attached. So this is a structure of the ticlopidine.